Thanks, Drew. I mean, so what we did, let's take a look over here at this mannequin here. I love the skin here.
Isn't that cool?
And that's great. So, you know, in regards to the Browlift, I'm going to point real quick, Bob, right over here. We have one little incision right there, one incision right there, one incision in the center, and then two on the other side. That's for the Browlift, which is lifting up the eyebrow. With this technique, we're, able to use that endoscope through small incisions. So, in general, when we take a look right over here, I'm going to kind of lift the skin up here, and we're going to gently and naturally, we want to lift up the eyebrow. And then part two of this, there's a little crease, there's a natural crease right here. And we want to make sure we make that incision in the crease so that we can hide it. And then at that point, we can still see if there's a little extra skin on the upper eye. If there is, that's when the upper eyelid lift or upper blepharoplasty is necessary. Okay. So brow lift first, in many scenarios, followed by an upper eyelid lift. So this, looking down...
I can't see any scars.
Take a look. I can't see the scar.
No. You can feel a little bit at the end of time.
And remember, that endotime takes about 9 to 10 months before it completely dissolves, and it goes away. You feel nothing.
I want to know what Guy did.
Sure.
And looking at his pictures, Guy, I know that this was not a chip shot.
His lower lids were complex. The lower lids in general are a complex structure. There are multiple layers. But the problem that Bob faced is he didn't want the shape of his eyes to change. And any standard blepharoplasty on you would have changed the shape of your eyes. And if you look at yourself right now, you have a perfect almond-shaped eyes. They're smooth. The festoons, the little malar bag, Bob and I discussed beforehand with his family.
In detail. These pouches here, that's what I originally talked about doing something with. And that's how the whole process started. Well, then they explained to me in detail what was possible and what wasn't possible.
What I tell people with malar bags or festoons is if you really don't like them and you want to aggressively go after them, there is a chance we're going to change the shape of your lid.
Right.
If you're willing to accept a 30, 40, 50% improvement to look natural, not know anything that was done, that's fantastic. And the one thing I'll say is if you look at Bob right now, I don't think anyone can tell any incision was made. And during his surgery, it's a little tough with the skin, but during this surgery, this whole layer of skin was elevated. The muscle layer underneath was elevated and secured to the bone up here. The cartilage of the lid was tightened and some skin was taken out. And what I told Bob was, we're going to get you 25, 30% better. And I don't know how you judge it right now.
Oh, I think we got 70%.
No, this was not your basic lower lids.
Right.
I mean, you essentially did a mid-face lift on that and had to do an eyelid suspension.
I think the real critical thing over here, and you said it before, is when you're going to have a procedure done, it's the consultation, it's your expectations, it's what's told you. It's told you beforehand.